I would like to welcome you all on behalf of Wemos and NUDOR, the National Union of Disability Organizations of Rwanda, in this webinar, and also on behalf of the Make Way Partnership, which is one of the sexual and reproductive health and rights partnerships supported by the Dutch Ministry of Foreign Affairs. And we are working all together towards operationalizing intersectionality in SRHR for health equity and justice. And this work that we will be sharing today with you is part of this program. In the meantime, as you enter, you can also write your name and maybe your organization next to your name so we know who is in the room. A few housekeeping rules. As I said, this session is going to be recorded, and then we will be sharing this recording as well as the presentation with you. So don't worry about note making. There is closed captioning available. Remain muted and turn off your camera to help also with the bandwidth, but also so that our sign language interpreter is visible to everyone. You can also select to pin the screen of the interpreter on your screen. And please keep your questions until the end, or put them in the chat and we will go through them at the end. With me today is also Ariane Dussange from NUDOR, and the consultant that helped us with this project, Dr. James Humuza, and we will all share with you the findings of the study and some updates regarding alignment efforts in Rwanda. But before we start, I want to share with you also that we want to keep this space safe, as with all spaces in our organization, in our partnership, Make Way. So bear in mind that we want to keep this a digital space where people can trust that they will not be exposed to any discrimination, harassment, or any other emotional, psychological, or physical harm. So a few introductory words on the topic as we start. So as you saw, the webinar is going to be on global health initiatives and health system strengthening. And we're talking about the alignment and coordination of Global Fund, Gavi, and the Global Financing Facility, or GFF, in Rwanda. But let's clear a bit some of the terms that we are using. So you will hear us using the terms coordination and alignment. When we talk about coordination, we will be referring to the coordination between the three global health initiatives that we are examining today. So we also call them the 3Gs. So GFF, Gavi, and the Global Fund. And when we're talking about alignment, we are referring to the alignment of these global health initiatives with national policies, and in this case, the national policies of Rwanda, which is our case of today. So this to keep in mind when you hear us using these terms. And with this, having a general idea of coordination of global health initiatives and alignment, I'm sure from your experience in your countries and exchanges with donors, you might have recognized that good alignment with country priorities can often be a challenge. So we would like to use Menti to see if we can pick your brains, your experiences, and see what you consider to be some key challenges that donors may have when they need to align with country priorities. So if you go to www.menti.com and use the code that you will see on the screen, we will put it also in the chat. You are asked to enter a few words, and yeah, let's see what we hear from you. The code is on your screen, and the website that you can access from your device, I'm also going to put it, is menti.com. So let's take a minute. Okay, I see some words coming in. Lacking capacity or will, politics and policies, I see is coming up. Earmarking of the funding, priorities, policies. Let's give it another minute. Lack of flexibility, the need to show results fast. I think you will see from the presentation of our findings that we also came across similar findings in Rwanda. Flexibility I see coming up a lot, and bureaucracy, the other side of the coin. Different agendas. Weak government coordination as well. Great. I think the word priorities is the one that got a lot of entries. Great. So thank you for sharing the thoughts. I think we will be keeping this word cloud. And with that, I would like to move on to share with you a little bit about the study that we did this past year together with NUDOR and our consultants. So that's the title of our study. We focused on the role of global health initiatives. So in this case, the 3 Gs that I presented to you before in health system strengthening in Rwanda. And we looked at, as I said, Global Fund, Gavi, and GFF, and whether their alignment with country priorities strengthens the system in Rwanda and how. So why did we decide to do this case study? So first of all, we found it very relevant because the 3 Gs can really influence the health systems of the countries where they operate. And we have seen this a lot throughout the years. It was also a good timing because it happened that Rwanda became one of the pilot countries that the GFF started to pilot an exercise on improving alignment of donors. And actually, Dr. James Humuza will share a bit more on this specific effort as he has been part of it. And then we thought that it would be a very useful tool for advocacy towards, on the one hand, donors and the 3 Gs, but also the government to improve alignment and coordination. So the general objective, I shared it already, we took a health system strengthening approach, and we focused a lot on the impact that the 3 Gs have on domestic health financing, on transparency and accountability, the human resources for health, so the health workers, how well they contribute to leaving no one behind, the civil society engagement, and also their impact on gender equality. So I'm going to share with you a little bit some key findings in each one of these domains that we examined. Before that, a few words on the methodology. So with the help of our consultants, we did a review of documents, peer-reviewed reports, unpublished reports, and also whatever was publicly available by the 3 Gs regarding Rwanda, and also from official Rwandan documents. And we also did some key informal interviews with a variety of stakeholders, government, development partners, and civil society. And then we analyzed our findings. So moving on to the key findings. First of all, I want to speak about some key findings regarding health financing. So what we saw from our research is that there is committed leadership and a strong policy environment in Rwanda that has greatly contributed to a better alignment and coordination of the 3Gs and the national plans. And Rwanda has policies like the aid policy of 2006 and the aid procedure manual of 2011 that have contributed towards that end. Then we saw that the government is doing regular audits that are also improving the financial flows, the transparency and accountability, and therefore we heard from the donors that are, because of that, are more willing to channel resources through the national treasury as well. In terms of how much the 3Gs contribute to domestic resource mobilization, the findings were a bit mixed. From the participants, we heard that high donor funding contributes usually to the reduction of domestic resources for health. Then we examined the trends of the financing, and we saw that indeed in the past 10 years, the external financing to Rwanda has decreased. There is an increase in domestic resources. However, it's not keeping pace with the decrease in external resources, so it's not enough yet to fill the gap. And we also heard a lot about the misalignment of planning cycles between donors and the government. In terms of how well the 3Gs are supporting the health workers, we found out that they do that in different ways. For example, the Global Fund is providing financial incentives and support salaries through the government payrolls. They also support infrastructure and training, pre-service and in-service. Gavi, for example, we found that they support cold chain supply systems, and the GFF provide technical assistance to health workers and also some financial incentives, particularly to community health workers. A very interesting finding was what happens when development partners reduce the support. So we heard about how when the Global Fund reduced support towards health workers, some of them were laid off. And as a result, they left the same high workload to the remaining group of health workers who were therefore much more overburdened. Then in terms of civil society engagement, that was also a very important part for us in this study. What we saw is that in general, civil society organizations do participate in planning meetings of the 3Gs, where strategic direction and priorities are also discussed. And most of the respondents from the government and the development partners said that civil society organizations are indeed involved in high-level decision-making within also the Ministry of Health. Of course, as I said, we had various key informants, governments, development partners, and CSOs. And what we heard a little bit from civil society colleagues is that the involvement of civil society organizations who are representing vulnerable groups, for example, is still challenging. It's still not mainstreamed in many of the activities of the strategizing and planning of donors in the country. So that was an interesting finding indeed. Then, as I said, we also explored what is happening in terms of gender equality and the impact of the 3Gs into it. And what we saw is that all respondents reported that gender equality objectives can be found across all the programs of the 3Gs in the country. And there was an agreement that there is strong complementarity between the 3Gs approach to gender policy and activities and the government's approach. So that was a positive finding. However, we noticed that there are still misunderstandings and confusion on people's understanding of gender equality. So what it really means, what it entails. And we heard that from our key informants as well, that there is need to still strengthen the understanding of people towards gender equality. So that, of course, made its way to our recommendations as well, that you will see later on. Leaving no one behind was a key concept when we were planning this this research project. So we wanted to examine how well the 3Gs are contributing to it. And what we found is that a lot of the programs and interventions of the 3Gs, either directly or indirectly, address the concept of leaving no one behind, as is defined by UNDP and the WHO. We also saw that there is funding that is going towards vulnerable groups. For example, the poorest of the population, child-headed households, women in reproductive age with reproductive needs, female sex workers, men who have sex with men, etc. But a concern and a challenge that we came across is that there is limited data on the demographics of these key populations. Also, the LGBTQI persons, persons with diverse types of disability, drug use with the stakeholders, the informants, is that if you don't have the data on these people, it's very difficult to meaningfully include them in the planning and the implementation of activities of the 3Gs and the government. So this was a recurrent theme of the discussion and the literatures. So based on these elements, we developed a set of recommendations for improving alignment and coordination in Rwanda. So first of all, to ensure effective alignment and coordination, it is important that donors make their funding predictable and that they pledge this ahead of a fiscal year to ensure that the government can plan accordingly. And also donors that are working at lower levels, so at district, at program level, should plan jointly to safeguard efficient implementation and synergies. We noticed the need for improved documentation. So the part on the lack of data that I mentioned before. So government and development partners should improve documentation to make relevant data available at the right time. For example, obtaining financing data at disaggregated level enhances better analysis of financing trends and can facilitate sustainability plans. We shared with you that we found there were mixed evidence regarding domestic resource mobilization, but still we think it's still relevant that the government needs to improve domestic resource mobilization to ensure the continuity of successful programs after development partners pull out. And from their side, external funders should avoid pulling out too fast, but rather gradually decrease funding after having done a vigorous planning and agreement with the government for a proper transition. Human resources for health was key for health systems. And we saw that the 3Gs have benefited health workers, but it was very worrisome to see that development partners pulling out are really causing trouble to the health workforce. So good assessment is needed to understand the real workforce needs based on demand. And this would inform also the government about the required workforce to maximize health outcomes. So it's an ongoing discussion how well Rwanda and in general countries should invest in human resources for health. The role of civil society organization is always relevant. It's always a key topic, and CSOs needs to be recognized, even with a budget line to support their activities. So when external funders that support civil society pull out, CSOs continue their valuable work. And CSOs can also contribute with studying population groups that need special attentions or are minoritized and marginalized. And here comes again the importance of good data. And finally, going back to the topic of gender equality that I mentioned before, we saw that there is still need to study the understanding around gender, feminism, cultural values around that by all stakeholders, because these sort of clashes and misunderstanding have the potential to undermine a healthy gender equality development in the countries. So I'm going to close here. You have all received the policy brief that also captures the key findings and the recommendations that are presented to you. And as I said, these are going to be available also after this webinar. So now I would like to...
I love that. I love that.
So I would like to give now the word to Ariane from NUDOR, who is going to dive into the concept of leaving no one behind and its relevance to this work. So Ariane, over to you.
Thank you, Miriam. Hi, everyone. Ariane here, NICWE Country Coordinator, sitting at the National Union of Disability Organization. Maybe, can you allow me to share my screen, Caroline?
I stopped sharing, so now you can share.
Okay, great. Can you see?
Yes.
Oh.
You just need to put it in presenter mode still, Ariane.
Okay. Let me try.
But it is too small.
Yeah.
Okay, how about now?
Perfect.
That's perfect. Thank you.
Okay. Yeah, thank you so much. I'll really be so brief because a lot of information and insight will also be shared by the consultant himself, but mine will be simply to reflect around the relevance of alignment vis-a-vis the concept of leaving no one behind. Maybe to give it a bit of retrospection, because all these things start from global kind of initiatives such as MDGs, SDGs, and from Rwanda, we all saw that Rwanda has really performed very well in terms of implementing the MDGs. For instance, some of the key indicators such as improvement of maternal health, like reduction of infant mortality. And just to say that most countries, most countries have really performed very well, also thanks to these global funding mechanisms. But from the realizations, I think the progress was realized to be counted in averages, whereby some people were really left behind. Because, for instance, if you measure that a country has achieved, for instance, maternal health mortality, HIV/AIDS prevention and treatment, that was not really, it was not necessarily representing like the majority of a country. For instance, that was not including women living in rural area, maybe going through discriminations, in extreme poverty, because they were still going through challenges such as home delivery, because either the distance from the home to the health facility is really long, or maybe this person cannot really afford a delivery in a health facility. Now, after that, I think with the introduction of the SDGs, which is the Sustainable Development Goals, it really focused more on the concept of leaving no one behind. Of course, because the realizations of the MDGs mass progress, but with some people left behind. Now, after the introduction of SDG, I think that's where even this alignment initiative also came in, where they were now an idea of starting to know, okay, how much is being spent in a country on this and this, and maybe this opportunity to invest in this country, where can we put more resources? Now, as it has been highlighted by Miria, the alignment is very crucial because it comes in a way to strengthen countries' agenda in terms of development. And for the 3G case, I think it has really directly, I may say, directly impact the realization of leave no one behind, because it came where the country was really rebuilding itself after the genocide and the war in 1994. And that was implemented through the EDPRS 1, EDPRS 2, and now through the NST 1, the 7 years program of the transformation strategy. And it has really shown that it is possible to not leave people behind. And that was possible because this was really well coordinated and aligned with the national priorities, where we saw remarkable coverage, for instance, of community-based insurance, where 90% of Rwandans have been able to pay for healthcare services. And those who are really, the most poorest who are not able to pay like the contribution were given a kind of financial subsidy. And all that was possible because of the a strong alignment mechanism. And I think it's not only this example, because there are also other examples such as the community health workers structure being put in place, whereby it is really, the health center is really close by, where you can get primary care treatments such as family planning, even malaria treatment, etc. But we cannot just say good things about the alignment. That of course, there are good things. We need to praise it and call upon more global mechanisms, like to invest that, considering the strong alignment to government strategies. But as Miria said, the pull out of some global mechanism really affects people who were vulnerable. That means if a country was supporting a number of people with compounded vulnerabilities through a program, they would definitely be left behind, because now it will be time to prioritize and see what can we afford, what is possible. And now we'll have less healthcare providers. And we saw this with the human HR for, how do we say it? Human resource for health, whereby now it is even difficult for health centers to provide reproductive health services for young people at the health center, because we have less staff who can be able to do that and still do other, provide other services to the general community. So like that, I think people will still be left behind, and that's our biggest challenge. Another one is limited engagement of civil society organization. Although there were some consultations, as I remember, I was part of the Global Fund SSF HIV program, but I think there were no strong engagement in terms of bringing civil society organization on the table where decisions are being taken, especially civil society organizations working with people, those called key population, because it was not really well understood. It came as I mean, the Global Fund came with that, and the countries had to embrace it. And the engagement was not really that straightforward, whereby some decisions were just made without them. But also another thing is that the country, maybe at that time, I think now there are some improvement. There were limited data about who's left behind. For instance, when you talk about people with vulnerabilities, first of all, who are these people? You know, how are they vulnerable? What are the factors around their vulnerabilities? And how can we engage them maybe to make sure that their issues are understood, are heard? So that seems to be a challenge whereby we don't really know who is left behind. And for that, I think there is a need to have government consciousness about digging deeper into, you know, coming up with researches or maybe collecting this data in a routine way, but in a more disaggregated manner so that we understand who is vulnerable. And I think besides alignment, efforts which are good, in Rwanda specifically, we are still facing challenges that are attached to social cultural values, whereby most of the decisions that are made, especially decisions that would affect people who are already vulnerable, are made through or maybe via moral values, whereby someone would say, okay, this is against it's against my beliefs, this is against my culture. I would not pass this bill because I think it is disrupting, you know, the culture and how I believe, and maybe things I believe in. Then we'll have people still left behind, you know, although there is maybe fundings, but because these people who are making, or maybe taking this decisions will have policies that are not really inclusive, will have a room full of, allow me to use that term, old people with no young voices to speak for themselves, to voice out their issues and propose ways this issue could be resolved. So my last word would be, through alignment, I think it is possible, or maybe it is very key to think about alignment, to not leave people behind, but it could be way efficient if that is really coupled with a meaningful engagement of civil society organizations, especially those who are dealing with vulnerable groups, but of course, young people themselves, because they understand more their challenges, they understand more how these issues are affecting them. Therefore, they also have a hint on the solutions. Yeah, so like that, we can really have integrated policies, we can have inclusive policies, practices, and yeah, the real equity will be achieved. So I may stop by there. Thank you so much.
Thank you, Ariane. If you can stop sharing, then I will go back. All right. Thank you very much for bringing the discussion to the leaving no one behind concept that is so key in all of our work. Moving on, we are going to share with you, with the help of Dr. Humuza, some updates on some new alignment efforts that is happening in Rwanda that is related to the work of the Global Financing Facility and its alignment working group. Just to give everyone a background, because before I pass over to Dr. Humuza, the GFF established this alignment working group last year, and in this group there are members of different constituencies that are part of the GFF governing body, the investors group. There are GFF countries, civil society, foundations, bilateral agencies, and the WHO. And now this group is piloting an alignment framework in 4 countries, and Rwanda is one of them. And just a note is that the GFF is also going to plan a webinar on this particular exercise in Rwanda early next year. So when we know the details, we will make sure we share the information, because this webinar today, of course, is not to replace anything, but it's going to be very interesting to hear their perspective on the exercise. And with that, I would like to invite Dr. Humuza to take over and tell us his experience as he participated in this pilot exercise. Dr. Humuza, over to you.
Thank you so much, Miria. Can I share my screen? Or I keep on this?
Just let me know when you want me to change the slide.
Okay, thank you very much. Thank you for that brief description of the GFF and how they established the global how they established this alignment framework. Basically, to expand on what you just said, the alignment framework is built on 3 pillars of 1 plan, 1 budget, and 1 report. So basically, 1 plan alignment is said to be complete when a countrywide shared and agreed operationalized plan is arrived at through extensive stakeholder consultation. And by a stakeholder consultation, we mean, all the partners, including those who do the direct budget support, those who provide the off-budget support, and the civil society organizations, and the private sector. So the second one is, 1 budget, as I just said, and alignment is said to be complete when a comprehensive budgeting process reflects the contribution of all the stakeholders to match the priorities outlined in 1 plan. And this basically means that for an alignment to be complete, the budgeting process has to capture the contributions of the stakeholders, whether on the budget, whether off budget, but at least it has to capture all that information. And the 1 report is also said to be in alignment, complete alignment, when a shared set of indicators to monitor progress in achieving the targets and results are stipulated into 1 plan. So this means that once you have designed a strategic plan and an operational plan, well budgeted, so it has to reflect the indicators, the monitoring system indicators have to reflect the information also from the stakeholders. So these main domains, the 1 plan, 1 budget, and 1 report, have got several subdomains, and in each of those subdomains there were statements, and from those statements the stakeholders were asked to rate the statements under each domain. I don't want to present the detailed methodology, but what I can say is that the stakeholders were given the opportunity to examine themselves, to diagnose themselves, the status of the alignment based on 1 plan, 1 budget, and 1 report. And they, after examining themselves, they submitted the reports. I cross-checked, and whatever I saw that was not clear or did not have any sufficient evidence support the level of alignment. Then we went to the stakeholders and asked them to support, to provide evidence for that. So in the end, we had a harmonization workshop for all the stakeholders to agree on the level of alignment that they have provided. Currently, we are writing a report, and it should be out. I should finish it before end of this month. So basically, this entails the process that I've been talking about. We had 2 technical working groups. The health financing technical working group, which was a physical meeting. We had also another, virtual development partners meeting to present the alignment tool and to explain the expectations from the stakeholders. And we got their comments. After that, we organized the workshops of stakeholders. As you can see, we had 5 groups of stakeholders. The first one is the development partners who provide direct budget support. In other words, their funds are channeled through the government systems. Then we have also another category of development partners who do off-budget support. They implement the activities alone, but their plans are aligned with the national plans, meaning that even though they have their own implementation, but their activities are aligned to the national priorities. Then we had the civil society organizations that were presented by the NGOs forum, and these also were given the opportunity to complete the alignment tool, and they, like the development partners, they also expressed their concerns as well as those development partners. We had also the government, which also did its part. They also assessed themselves, and especially they are looking at issues. They are looking at the successes, but also issues that might be hindering the alignment of the stakeholders to the government systems and processes. And lastly, we had the private sector that also did self-assessment. So after this, we had the harmonization workshop with the representatives of the stakeholders to make sure that issues that were not agreed upon were discussed. There was a brainstorming, and some of those issues were agreed, and they were incorporated into the minutes that are now supporting us to write the report. Next. So these are the major outcome of the assessment, and I'm very happy that some of the outcomes are pretty much the same as the outcomes that we got when we documented the alignment of the three global health initiatives. So along one plan, the first issue was to review the coordination structures and processes as well as the engagement, because among the areas of improvement under the alignment was to improve the coordination of the stakeholders at national level, but also at the district level in terms of planning, but also on the level of engagement. Some stakeholders, especially the civil society organizations, were not well aligned to the mainstream planning, and there was a call for more engagement of these stakeholders, especially building the capacity of the umbrella. The engagement of DPs and other stakeholders in the health sector, especially during the medium-term expenditure framework working group, because we saw that actually the majority of the CSOs don't know even what means the medium-term expenditure framework. They have limited understanding of the budgeting process. So there is a need for the ministry to engage some of these stakeholders, especially the civil society, so that they understand the budgeting process within when they're planning. There also a need to enhance the alignment of subnational level, especially the districts, especially aligning the plans. Number 4, the alignment of implementation plans and processes with other government agencies. Here, the issue mainly was other sectors that have activities, health activities, but also other health institutions that seem not to align well with the main Minister of Health. The last point on the one plan is enhancing the capacity of the CSO platforms umbrella, as I was saying, because in Rwanda we have more than 139 NGOs, and all these NGOs cannot be invited in a meeting. And what the platform said was to try to increase their capacity through the support of the government and other development partners, so that they can have the capacity to include as many views and opinions as possible from the member organization. And I agree with Ariane, what she was saying. Many organizations and many views are not mainstreamed into the main planning, basically because the umbrella of all these organizations does not have sufficient capacity to make sure that they include, the views of this organization. And when it comes to one budget, there was a need to revitalize the resource tracking tool. Resource tracking tool is a tool that captures the budget and expenditure of all the development partners and the government. So what it means is that during the start of the fiscal year, the development partners and the government and everyone who contributes are supposed to complete their budgets in this tool. And towards the end, they are supposed to also complete the tool with the expenditure data. But the tool apparently is not functional. And so there is the need to help, to revitalize this tool so that they can report and align the expenditure and budget. There was also a need to, a call to review the limitations and reservations around using the counter procurement mechanisms, because most development partners are still using the separate procurement systems because of the issues like bureaucracy, but also other regulations that the development partners seem not to be comfortable with. So there was a call to review that so that there can be more alignment. There is a need to improve dialogue to build trust and confidence to move towards one budget. This especially is targeted at the funders who are still preferring to do the off budget, and because mostly that's the way their policies are, mainly determined by the countries who are funding these development partners. There is a call for dialogue, because if the government says that we have a system in place, we have the integrated financing management system, our public financing mechanism is very good. Other big donors have used them to channel their resources. So the government says, why not other donors to channel the resources through the government systems? The last one is the inclusion of the private sector as part of the overall sector budget and use their comparative advantage to prioritize resource allocation. So the private sector is still operating. First of all, it's still small, but it's still operating as a different entity. And most of them actually don't know also the MTF. They don't know the budgeting cycles of the government. So there was a call to, for them to be part of that process and improve that alignment gap. The last one, the one report, all one MNE, the key emerging lesson was to review and strengthen the mechanisms for tracking collective actions from joint review mechanisms. Here, this came up because there are several review mechanisms, including the midterm review, the annual reviews, the joint sector reviews, but the recommendations that come from out of these reviews are sometimes difficult to implement because of different reasons. And so there was a call to strengthen that mechanism and track those actions. The second one was about the stronger stakeholder engagement in the dissemination of data use and data sharing policy. So there was a call here for the ministry to make data easily available when other stakeholders need them, especially for planning purposes, because they allege that when they ask for the data, they can spend weeks and weeks or months without receiving the permission, and so they called for the quick access to access the data so that it can inform their decisions and planning. The third one is enhancing the stakeholder, especially the CSO's roles in defining indicators and setting the targets. So here, this was very critical because the civil society organizations raised issues that they don't participate in the initial planning, they don't participate in the design of the major indicators and setting targets. And they say that they are only invited when they are coming to the dissemination of these documents. And so there was a call to, to involve them to be part of the mainstream process. But again, this comes to what I said before, that it's difficult to invite 139 organizations, but rather there is a need to build the capacity of their platform, so that the platform has the capacity to collectively, take the views and opinions up to the mainstream planning. The last one is strengthening the integration of databases to enhance interoperability. Apparently, we have one main database, which is the Health Information Management System, but there are several other databases that's it's still difficult to access information in other databases. So there is a need to build the capacity so that there is more interoperability between different data systems. These were the initial initial findings. I extracted them from the PowerPoint that was presented in the investors group in Accra, Ghana, and we are still writing the report, and there are more information that came out of this alignment. But what I can say is that the three major global health initiatives, the Global Fund, the Gavi, and the GFF, have 100% alignment to the government systems, and this is because of the enabling environments that Miriam spoke about, the consistent regular audits by the Auditor Generals, and the issues of misalignment of donors during planning. Those were also given during the alignments. And that's it. I look forward to sharing you the comprehensive report on the alignments.
Thank you, James. Thank you very much. That was very insightful, and maybe good to share also with this group that this work that we did with NUDOR under the Make Way was also used as a resource during this exercise that happened in Rwanda and James described.
Absolutely. Actually,
So,
when
yeah.
you read the report, you're going to see a lot of references for that
Great.
document. Yes.
Great to see our work being useful. As every webinar that respects itself, we run out of time. So I will ask kindly everyone to stay a little bit longer, because there were a few questions in the chat that I saw. Samuel, I saw you asking if we are going to compare this study with the study that we are doing in Kenya about the African Medical Equipment Facility. It's a bit different approach, because in the African Medical Equipment Facility, it's only the GFF that is contributing to it, not all the 3Gs. So, but definitely we are going to continue the advocacy work around that, at least towards the GFF for sure, and by extension to other development partners that use similar approaches of blended financing. So to be continued. There was another question by Fidelis about the plans of the other Gs to support community health workers. I saw that at least on the GFF, that they are focusing a lot their work now on primary health care, and supporting community health workers was coming up a lot in the last investors group discussion, also supporting them financially, helping countries to incorporate them in the health system, in the government payroll as well. We heard that from some countries. So I saw it in the GFF. I don't know for Gavi what are the plans, but if others know, we will be happy to hear. There were some questions from Jackie as well about if efficiency was one of the focus areas to leverage on domestic resources. Absolutely. In our work, we were looking really to the trends of how domestic resources were moving alongside the trends of external funding. And when we talked about civil society funding, yes, we were talking also about programs that the 3Gs have, where that civil society organizations are implementing. And in comparison with Uganda, maybe others are in a better position to make this comparison. So I won't have an overview now of the support in Rwanda and Uganda in front of me. I don't see other questions in the chat. We are going to be, I see Yvonne's hand up. If you can, yeah, ask your question or share your thought briefly, so maybe we can have others as well. Yvonne, over to you. And thank you, Lisa, for bringing up also the topic of corruption in the chat as a major factor that donors are avoiding the country systems. Yvonne, I don't know if you are speaking, but we cannot hear you.
You don't hear me?
Now we do. Yes, go ahead.
Okay. Actually, I want to ask Mr. James a question about human resource tracking tool and the HMIS. Among the challenge you raised, you and Ariane, the presentation, there is an issue of gender and inclusion. Now, I would like to ask Mr. James if the human resource tracking tool is not only assessing the expenditure issues, but also if concerning the budget is gender responsive budget tool also. So the other one, what are the key intervention or strategic action to enhance the alignment of subnational level and the capacity of civil society? The last one, concerning the HMIS, actually there are many other tools that are being developed, like disability management information system, the management information system which are being used in the social protection, the system used by NUDOR, how there's a system can be interconnected and being harmonized so that they can generate data, as it was also among the challenge. Thank you.
Miria, can I go?
Yes, please. Yes.
Okay, thank you. That's that's an interesting question, because I wish perhaps we had someone from the ministry to explain this tool. But from the outlook of the tool, the design of the tool, it's designed to track budget and expenditure of of all those who are contributing towards the health sector financing. I mean, it tracks the government expenditure, it tracks the development partners funding, and some CSOs, by the way, but there are very few who channel their resources through the HRTT. Whether it tracks gender budgeting is another issue. Maybe if someone does sub-analysis to look at the budget, the budget lines, and see if that is tracked. But broadly speaking, it tracks the budget and expenditures from the government and any other stakeholder that channels the resources through that tool. And but the gender budgeting instead, I think, is tracked at the Ministry of Finance, because when you present your budget, this at the sector level, if you don't have this gender budget statement and gender budgeting within your budget, the Ministry of Finance will not give you resources. So you have to present it there. But I'm not sure if it is captured under the health resource tracking tool. The other question about the capacity building of districts, I think there are already strategies in place. If you read the strategic plan, there are several, interventions for capacity building of the district entities. But I think there has also been, issues. You build capacity, there is attrition, people leave, you have to build the capacity again. So it's something that's that has to be maintained, and perhaps I would look at this as maybe more at another angle. How do we sustain maybe the workers so that they don't leave? Otherwise, this issue of capacity building is always there. It's always in the strategic plans, and they are always doing the capacity building. When they go for monitoring activities, they do supportive supervision, and in that course they build the capacity. But for the same reason, because the staff leave, there are always those gaps. I've forgotten the third question. Can you come again?
Yeah, the last one was concerning health management information system and other existing systems. What do you plan to do to harmonize all of those systems and to generate information so that everyone may be accessible to them easily?
This is a huge undertaking, because there are different data systems, and the health sector also tracks its own data. In other social sectors, like in the Ministry of Agriculture, they have indicators that pertain to nutrition. In the Ministry of Gender, where there is early childhood development and nutrition, they have also their indicators. But also within the ministry, also there are other institutions, and so bringing these databases needs experts to do that. And I'm happy during the alignment meeting, some stakeholders pledged support to link these data systems so that there is improved interoperability and alignment.
Thank you, James. You gave us a lot of insights today. I will need to wrap up. Jackie, I saw your clarification about what you meant about different levels of civil society engagement. And I think, yes, this is something that we also captured in the interviews, that indeed CSOs had different levels of engagement per G. Also has to do with how many years every agency exists in the country, and how well they have built up this sort of mechanisms. So, for example, Global Fund was much more years than the GFF in Rwanda, so there was a more strong mechanism there, indeed. Okay, thank you all actually for staying the extra time, much appreciated. We will be sharing a link where you will find the recording of this session, the brief, the policy brief of our study in case you haven't received it yet. And yeah, keep an eye also, we will be sharing information about GFF's own webinar on alignment. And we are continuing the work on this topic with more studies. So we will be organizing more sessions like that. A lot of thanks to our interpreter. Thank you for being there so much for your hard work. And I will now close this session. Thank you all.